I'm delighted to welcome Khadija from Morocco. She's a PhD student in Settat.
Yes,
and she's got
yes.
Right, thank you. And she has extensive experience in midwifery, neonatology, public health, education, and research. And yet she looks so young. How does she manage it? So welcome, Khadija. If you want to say anything more about your background, feel free. But otherwise, do go ahead with your presentation. Thank you.
Yeah. Thank you, Linda. Thank you, Caitlin. So good evening, everyone. First of all, I would like to express my sincere thanks to organizer of the IGM 2025 for giving me the opportunity to be a part of this important event. It's an honor to contribute this global conversation in my part about midwifery and mental health that can share with you a topic that deeply impacts the well-being of pregnant women, namely the fear of childbirth and associated factors. Okay. Like introduction, pregnancy and childbirth are significant physical, psychological, and social events in women's life. However, for some patients, their events can give rise to major worries and anxieties. When the fear associated with childbirth reaches a pathological level, it's become disorder requiring specific recognitive and treatments. This disorder known like tocophobia or fear of childbirth or fear of birth. It's such a question of the country can lead to significant physical and emotional handicaps. Tocophobia-like definition is a serious anxiety disorder, relatively common yet often overlooked, which can lead to adverse effects during pregnancy, childbirth, and postpartum period. These effects can be severe, resulting in negative psychological and emotional consequences for the mother, the newborn, and the family as a whole. This tocophobia or fear of childbirth have some symptoms and some reasons. Some symptoms like stress symptoms, an impact of daily life negatively, a desire to have a cesarean section, and willingness to avoid pregnancy and childbirth. It means this woman won't be pregnant and not want to have a baby. The reasons of tocophobia, like fear of pain, episiotomies, instrumental vaginal deliveries, the birth of disabled and stillbirth child. We have a lot of factors of this tocophobia, but we can resume like young maternal age, advanced maternal age, near parity, pre-existence, psychological problems, insufficient support, social support, preterm birth, history of abuse, of violences, obstetric problems, and complications. We have some complications as, according to theoretical studies conducted in this area, fear of childbirth and negative experiences during previous pregnancy as identified as key factors related in this request of cesarean section, especially among preemie parents. This request also increases the risk of maternal and neonatal complications like PTSD, depression, fetal distress. Therefore, it's important for obstetric healthcare professionals to be aware of these symptoms and complications of tocophobia and to understand the treatment options available. In Morocco, according of this data, we don't have assertion about psychological pregnant women like tocophobia, fear of childbirth, or something else. But we have another data like, according to data from Ministry of Health in 2018, the cesarean section rate was 21%. However, since 1985, the international health community has considered that an ideal cesarean rate should be between 10 to 15%. When medically justified, a cesarean section can effectively prevent maternal and perinatal mortality. And morbidity. It can lead to major complications, sometimes permanent disabilities or even death. In general, cesarean section should only be performed when medically required, not a choice. It's a solution. It's like a treatment. For the classification of this fear, we have three. First one, primary tocophobia, when the fear of childbirth exists even before the first pregnancy. It's referred to as the primary tocophobia. This anxiety may begin during adolescence or early adulthood. Although sexual activity may be normal, contraceptive use is often strict and consists. Pregnancy is avoided primarily to prevent the childbirth, to prevent to be pregnant. The secondary tocophobia, or the secondary type, it's some women develop a fear and avoidance of childbirth following a traumatic obstetric event. It means this woman have a negative or a bad experience before about birth during a previous pregnancy. Most commonly, it stems from traumatic delivery, but can also occur after a normal delivery, miscarriage, stillbirth, or termination of pregnancy. And the last one, it's about tocophobia as a symptom of depression, but it's less frequently. Prenatal depression may manifest as tocophobia. In this case, there is no morbid fear of childbirth, and the fear stands in sharp contrast to the woman belief prior to the pregnancy and prior to the depressed episodes. Assess the tocophobia to evaluate. We have a lot of skills, but we can resume it as first one. It's the French fear of childbirth assessment skills that we had used in our studies. It's in French. It's validated in French adaptation of the psychometric properties of traumatic event scale. It's scale used to PTSD evaluation. Translated as the fear of childbirth assessment scale. In French, we call évaluation de la peur de l'accouchement for pregnant women. This scale consists of 5 factors. It's including 21 items rated on the 4-point Likert scale, with response option ranging from not at all to often or completely. It's about the question. It's about the question. The total score it ranges from 21 points to 84 points. We have another scale called Wijma Delivery Expectancy Questionnaire. It's used a lot, and the fear of childbirth scale. And there are a lot of five other skills, but they don't use it a lot. Okay. The aims of the study. The study aims to assess the level of tocophobia in the pregnant woman in our city and identify associated factors. The study focused on the factors that contribute to fear of childbirth and how midwives can connect with women to provide the support they need. Midwives are often the first to identify signs of tocophobia or this anxiety, which can have significant physical and emotional impact on both the mother and her baby. Through early detection and open communication, midwives can build trust and create a supportive environment that reduces this anxiety. This study is quantitative studies based on data collection involved a structured questionnaire divided two parts. The first section is about tocophobia factors, and the second part about the fear of childbirth in the French version of this tocophobia. Our main results: the average age of participants was 26 years. Women over 35 years of age exhibit a very high tocophobia score, indicating that age is significantly associated with the total tocophobia score. This fear of childbirth score is a higher among multifarious women than primiparious women. It's conversely, the literature offered reports that primiparious women showed significantly a higher fear of childbirth score. The women who have birthed vaginally had higher fear of childbirth score, with significant associates in trauma anticipation, cognitive intrusion, and hyperstimulation. The negative birth experiences showed a strong correlation with nearly all the factors of this score. As for psychological disorder, depression, anxiety, PTSD, almost all were significantly associated with this score and these 5 factors. And about the type of violences, such as physical, psychological, sexual, are significantly and negatively associated with the total of tocophobia and the 5 factors of the score. This finding suggests that prior trauma and psychological factors are a critical determinant of fear of childbirth or tocophobia. At the end, this study highlighted a link between tocophobia and negative childbirth experiences, psychological disorder, and the history of violences, a factor that require appropriate care. It's called for deeper reflection on the triggers of this phenomenon, the improvement of healthcare professional practices, and efforts that ensure that childbirth occurs under better conditions. Ultimately, assessing tocophobia is a crucial step toward improving the well-being of women and their children. And thank you. I will thank you for your attention. And once again, I extend my gratitude to the VIGM community and their teams. I welcome any question or comments and you may have in Arabic, French, English. You're welcome. Thank you.
Maybe next year you might like to give us a presentation in Arabic, because we haven't had that yet.
Inshallah, maybe, inshallah.
Because we do encourage presentations in different languages. Yes. I've just noticed that somebody popped up a question in the chat. So let me take a little look. Are all pregnant women offered childbirth classes?
Childbirth classes instead, we don't have, because it's about the knowledges of the woman. We have analphabet women. They never have studies, though they need to develop their knowledge. So they come in our health center, the small health center. It's about Ministry of Health, and we do some education. We give them the advices, how they need to feel this changing of the hormones, physical changing, how they can accept one day they have a birth, they will take the baby in their hands.
I think that Sandra, Kathleen has also, I'm not going to ask my question while others are asking. I'm interested in why you believe the older mom has a higher tocophobia score. Women in the US are waiting until their 30s to have babies, so this is very interesting.
Yes, because it's about the culture. The older moms, so they have another birth. The first birth, they may face violence or unaccepted coincidence. So they like a trauma with pain, lose of control of the whole phenomenon of birth. So this we call it a bad experiences. This transform this bad experiences to anxiety for the pregnancy. So they may train it. They may suffered of this tocophobia or fear of childbirth because they have bad experiences, but not a lot. It's some categories. It's question about the experience, the less experiences of the birth.
You don't have women in their 30s having their first baby and having a higher score?
No, here in Morocco, 30 years, it's a third birth or fourth.
Right, okay. So they don't
Yes,
wait.
they married adolescents at 18, 20, they have the first baby.
Yeah, okay. So
Yes.
my question was, do you think that women are becoming more scared of the whole process of birth because of all the social media and, you know, general rubbish that you get on the net nowadays? Do you think that's got any kind of impact?
For me, the social media, the videos like YouTube and all, they have like good impacts because they educate the women. They search, they looking for the information, so they don't looking for the bad information or rumor between the women, because here in Morocco they talk with each other. They say, oh, I have a bad experience about this, and then no, my cousin, my mother, my sister. So they share between them the bad experiences. That's it. In social media, they say the right information. So for me, social media, YouTube, a lot of this, they have a good impact. Not that impacts, because I have this conversation with this woman who has a lot of information about pregnancy, how to respire, for example, how to control the pain. They told me, I was looking for in Instagram or such a gynecology. They talk about this and this and this. So I find that it's good things, not bad things.
Oh, good. Well, I'm very pleased to hear that. Education is everything, isn't it?
Yes, of course.
Yeah, okay.
It's the key of this whole thing.
Yep, I know. I had I had another question. Oh, I was impressed with your cesarean section rate at being 20%.
Yes.
That's a lot lower than in the West, I have to say.
The cesarean section, we can say that we have a lot of numbers of this. Why? Because they have some fear. They don't want to feel this pain, this useless, this is how they choose the cesarean section to find a solution, but it's not a solution, it's a treatment.
Yes, I agree, but your cesarean section rate of 20% is quite low.
Yes, it's 2018. So now we are in 2025. Almost they are up, ground, not down. They up.
Yeah, as they are everywhere else. In the
Yes.
UK, it's 40% in some places, or even more, 50%, which is ridiculous, because we also agree with you that it should be between 10 and 15%.
Yes. It's about the complication of the pregnancy. It's not a choice. Yes.
No.
If the woman have some problems, medical problems, they can have a cesarean section with decision of the medicine, not a decision of the woman. That's the question.
I would say that's probably true here in the majority of cases. Would anybody like to disagree? Anybody else? Anybody suggest to us that cesareans are done from women to avoid the pain of birth? Anybody got any thoughts?
I didn't understand the question.
Oh no, I was just asking everybody else here. I was stating, I was hoping I was correct that in the UK, cesarean section is generally done for medical reasons, not for choice to avoid the pain of birth. But I was asking whether I was correct and whether this is different in different countries. But nobody has come back on that one. So there's another question here asking, when you have diagnosed tocophobia, what medical treatment is given?
So because we have here a problem with our job, like midwife, we don't have, for example, details of what I can do and what I do not. So if I detect this anxiety in this woman, I refer to the gynecology who gets in charge this woman. maybe transform to the psychological domain, or just support her or something else, because my job is ending here.
Yeah, that's perfectly reasonable.
I will add another thing. It's COVID. Corona, it's also upgrade this number of cesarean, because they have some fears like this.
How is COVID causing the cesarean section rate to increase?
The experience of corona of such woman, I ask her, because I have corona, I will confess, so I have some fear of my health, my baby health, so I would choose the cesarean section to not have some complications. It's not about the anxiety, but just the fear that she and her baby have some complications.
That's perfectly reasonable. The COVID was and the pandemic was a very frightening occasion, experience for everybody. So it's perfectly reasonable that women should come up with those ideas, and that's absolutely fine.
Yes.
Any other questions? Haven't seen any hands up. Okay, well, thank you very much then.